All right. Hi, everybody. I didn't think I was on camera. Hello, everybody. How are you? So I hope that everybody is doing well. I am, and I'm having my middle of the week hump day. Whoop 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 woo! It is hump day, and this is my relaxation evening. My work hours have gotten just out of control. And so Wednesday afternoon, Wednesday evening is my rest time. So caught me by surprise. I didn't think I had the camera on, and so hello. Okay, now then, welcome, Cericia. How are you doing? Good to see you. Hey, Tennessee. Hi, Pam Frenchman. Welcome. Hey, Dee Dee. Yes, we're doing a live stream, Daisy Sunshine and DB. Welcome. How are you guys doing? Yeah. All right. So just for just a minute, I'll say hello. I know for myself, like the show, the podcast and whatnot that I like to watch, it's kind of nice to see the people, while they're talking, but we're kind of doing it old school. I'm in the hook of bed. So, but there's a lot to talk about. So this is really about yesterday's testimony, the bombshell information that we got related to Lori Vallow. And kind of then I'm going to lead in a little bit to Leticia Stauch, because who doesn't love dissociative identity disorder? And then it'll be about time for Hidden, a true crime podcast, to have the audio up of today's testimony in the Lori Vallow case. So if you watch Leticia Stauch today, it was a disaster. And yesterday, it was a disaster. And I feel really sorry for Dr. Lewis. I think, it could have been better testimony, but I think she got a little twisted. I think the questions were a little bit misleading for what her role was as expert. I felt a little uncomfortable. There wasn't as much. The traditional data points, she didn't collect them. It's very strange that to do a diagnosis like dissociative identity disorder and not have a full background and history, even elementary, records, all and family data points, friends. It's very strange. A diagnosis like dissociative identity disorder, it requires a historical documentation, just to be able to rule out, malingering and confabulation. It just didn't go well. It just didn't. So it's sort of eerie, or ironical, that we have these two cases going on parallel. You got Lori Vallow standing trial for conspiracy in the deaths of JJ and Tylee, and conspiracy to commit murder with Tammy Daybell. And that you have that happening parallel with Leticia Stauch and the murder of her stepchild, Gannon Stauch. It is so interesting that both of these women, they're so similar. It's really something. So let me transition into this discussion about Lori Vallow specifically, and then I'll finish up with the more in-depth discussion about Dr. Lewis and Leticia Stauch. So we got we got the smoking gun, so to speak, or what I think the prosecution in the Lori Vallow or Lori Daybell trial believes is one of the smoking guns, and that is the DNA. So, I think there were a lot of us that were a bit concerned that tying Lori into these murders of the two kids, especially, that tying Lori into it was really more of a kind of circumstantial. Well, of course she had to have known because she wasn't upset when they went missing, but it needed more than that. Remember, reasonable doubt. Maybe she was a cruel hearted person and didn't care about where her kids were, but that doesn't mean that she's a murderer, right? So people were getting, I think, a little bit worried, but the hair was discovered. That's the great thing about duct tape, all you criminals out there. It grabs onto all kinds of yummy evidence. And the plastic bag that was around JJ's head, not the rest of the plastic, not the preparation of the body for burial and all that, but the actual murder weapon, which we believe was the plastic bag and the duct tape. Her hair got stuck in the duct tape as she's wrapping it around to keep the plastic bag on little JJ's head. That's it. Same as, a smoking gun, in my opinion. So that came out yesterday. I think it was quite shocking to a lot of people, but I think that Larry Woodcock was, while he's heartbroken, this is a nightmare that this family is having to live through. At least there is that sense of satisfaction that there is some direct evidence, and it does in fact look like she did it. She was there. So that's that. Now we don't have a specific association, I think, with Tylee at this point, but it's hard to ignore one if you have such direct evidence, right? This is only my opinion. That I'm not speaking in terms of an officer of the law, because I'm not. But as a neophyte, as someone who is interested in trials and criminal personality and whatnot, I think having that hair specific to the duct tape around the plastic bag that ultimately killed JJ, that's a done deal. Makes it easier. It also makes it easier to overlook, well, I don't know how Lori would have been connected to Tammy's death, or I don't know how Lori would have been connected to Tylee's death. It makes it easier to accept if she did this to JJ, then of course there was conspiracy with Tammy and Tylee. So that was a really great thing. I find it I think that the forensics putting Alex Cox's car right there by the house the night of the so-called paintball incident, that's very powerful evidence. But the question is, I think it definitely solves for conspiracy to commit murder, which is the same thing as murder, right? So that's there. But for the exact night that Tammy Daybell died, that's Daybell. He's caught, in my opinion. He did it. Alex was not in that house. Garth was sleeping right across the hallway from where this happened. So are we supposed to believe that Alex came into Chad Daybell's house, went into his bedroom in the middle of the night with Garth right across the hallway asleep, and killed his wife and then left? No, I don't believe that a bit. No, that's on Chad. I think they got Chad. Chad's in trouble. To me, that was really, really powerful evidence. The fact that she died, she had lividity on her back and the back of her legs, meaning she was lying prone. And then at 5:30 in the morning, he pushes her off the bed. I've been sleeping a long time, people. I've literally never had my legs tied up in the sheets or the blankets. Never. Not to say it couldn't happen. I woke up one time and my hair was wrapped around my neck. Same thing happened to my daughter one time, but that was really long hair, you know? So maybe your legs could get wrapped up in the sheets, but it seems, you know, maybe it could happen. But I think what I envision more, according to the evidence that they provided in court, I kind of envision that Chad had the pillow over her face. That maybe he was able to give her too much tramadol and she was, you know, asleep, you know, sleeping. And when he put the pillow over her face to interfere with her breathing, and that's where all the edema and whatnot came back from. That you do get the swelling in the lungs, the fluid buildup with opioid overdose. Now, tramadol is not technically an opioid. It works on opioid receptors. But you can overdose on the stuff. You know, you can do that. So they never found the bottle. She had the prescription, but they never found the bottle. So that is a question. Was that what they used? So I more envision that he was cutting off her air supply and she was fighting him. And maybe that's how she rolled and rolled, like he's straddling her and she's rolling, trying to get away from him, keep him away from her face and her nose and whatnot. Perhaps that's how she ended up getting her legs tied up in the covers. And then he's just freaked out after it's all over with. And he makes phone calls and all this. And then finally, after several hours, you know, he pushes her off the bed because he's too freaked out, perhaps. Maybe he was trying to change the timeline, but he's an idiot. Rigor mortis was fully set in, and there was lividity on her back and the backs of her legs. And I wondered to myself, did that bozo, Chad, did he go to sleep next to her after he murdered her? That's a horrifying thought, isn't it? But is that what he did? I mean, I don't have any explanation for it. It is a very strange set of circumstances that she would lie there flat so that she gets lividity. And then at 5:30 in the morning, he pushes her out of the bed because dead bodies don't move. A lot of people have said, oh, well, maybe she could have fallen out of the bed. No, she could not have fallen out of the bed. Dead bodies don't move, right? Dead bodies don't move. That's it. I'm going to, St. Elmo. I'm going to. So, yeah, exactly, DB. I think Chad was probably straddling her and she was fighting and her rolling underneath him, trying to get away. That might explain her legs getting, you know, tied up in the covers, the sheets and the blankets. Maybe I'm just using my imagination. You know, I don't know that to be factual, but anyway, so I think Pryor, you know, has a real problem. Pryor has a real problem with the condition of Tammy's body. Him claiming that she, you know, fell out of the bed at 5:30 in the morning, and yet she has the blood pooling on her back and her lower legs, and she's in full rigor mortis. And you don't go into full rigor mortis in about an hour. You just don't. It is again disturbing to me. I don't have any idea what it means. Look, I say what I mean what I say. Okay. I don't know what this means, but it is very uncomfortable that Garth was across the hallway and heard nothing. It's very disturbing that he came in and helped Chad pick his mom up and put her on the bed, and she's in full rigor mortis. There seemed to be very little emotion he kind of sounded like Chad on the phone. She was like, well, I don't know. I don't know. I mean, I don't know. And then Chad just takes the phone away from him and starts talking. And he seemed very cool and collected. They just seemed so emotionally devoid of connection, right? And here was this most horrendous moment in your life. I mean, you've got a 49-year-old mother who's really in great physical condition. She's doing all kinds of sports. And look, clogging is tough. That is some tough business. That is real cardio. I mean, it's tough. So she was very healthy. You know, Chad is going down. There's no question. But at least, like I said, the hair in that particular duct tape with that bag, that's Lori. They got her. I believe that they got her. Yeah, very immature St. Elmo's. I would agree completely. Yep. So, look, I feel a little bit. Okay, so let me see if anybody else. Is there anybody else that feels like they want to talk a little bit about Lori? I have not heard any of the audio regarding today. For Lori Vallow case, I did watch not all of the Leticia Stauch case trial today, but enough to be very cringy for Dr. Lewis, and I feel very sad for Dr. Lewis. And so, I'm happy to talk about that once we get done talking about Tammy DOUBLT. Probably wouldn't be fazed by what he did. He needs to make a plea deal for life. Yeah, St. Elmo, at this point, after yesterday, Pryor is a bonehead if he doesn't make the deal. I agree. Chad is in it deep. Chad's a killer. We know now that Chad DOUBLT is a killer. Do y'all agree or disagree? That, all the evidence, everybody was sort of like, well, I think that Alex was the killer and Lori and Chad were, that's what they wanted, but they convinced Alex to do it, right? Okay, well, after the evidence that we have now, I believe the evidence did show Lori Vallow killed little JJ. I believe that. And I absolutely believe that Chad DOUBLT is directly responsible for the death of Tammy. Directly. And so when Alex says, I think I'm going to be their fall guy, maybe he's telling the truth. Maybe Alex is not the one that killed the two kids, but maybe he disposed of them. But you cannot take away from Lori's hair being found on the inside of that duct tape around his neck. You cannot, you can't turn away from that. It is super disturbing regarding Garth. If Garth really knew nothing, then consider that Chad had to make damn sure that he was successful in killing Tammy with her making no noise whatsoever. Agreed. And I, that was the first thing I thought when I heard that there was the pink froth. The first thing that I said was that's an opioid overdose. That is there's a lot of ways that you can get, pulmonary edema, but the reason that I immediately in my brain, I said opioid overdose is because that's a stereotypical sign of opioid overdose. Before they die, they're breathing in a very shallow fashion. So they're not getting any air that goes all the way to the depths of the lung. The air's moving in a really shallow fashion. And the result is that the bottom part of the lungs is starved for oxygen and circulation. As a result, just like when you're up to high altitudes, pulmonary edema is a big problem trying to do things like climbing Mount Everest. Okay, so it's one of the big killers up there. There's no oxygen, and the body responds with swelling when it doesn't have enough oxygen in the lungs. So when I heard that, I said, "Oh gosh, that sounds like an opioid overdose." She's kept alive for quite a while through the very shallow breathing. The body responds with the lack of oxygen. The body responds with swelling because it believes there's like some sort of an injury. And then as all that fluid gathers in the lungs, then the person basically drowns of pneumonia. And the blood is coming out of burst capillaries. So it's a fairly stereotypical sign, either opioid overdose, congestive heart failure that's been untreated, or altitude suffocation. So had she been under some sort of drug that would have restricted her airways, would have had her breathing very shallow, then there wouldn't have been a lot of noise, right? It would have been fairly quiet. So, people that don't take tramadol, even though tramadol doesn't make you intoxicated, like, let's say, what's it called? A Percocet, like a Percocet would do. It does make, if you're not used to taking tramadol, it can make you very, very sleepy. A lot of people that take it for, like, after minor surgery and things like that, that's the hallmark. If they'll take it and it'll make them sleep. So now it also, tramadol is notorious for causing people to vomit if they overdose, if they take too much. So no. They did say that she vomited, didn't they? Yes. They did say she vomited. So maybe it was the tramadol. Huh. Okay, so maybe they did maybe he figured out a way, maybe he like crushed up the tramadol and put it in some food or something to hide it. And then that caught, she vomited, like Shanann Richek vomited that night, remember? Then she started vomiting, and by the time she got back in the bed, then it wasn't long after that, then she died. So it could have been but why? Oh, well, they wouldn't have found the tramadol because they only had her liver. She was embalmed, so they would have only had the liver, which might not have shown the tramadol. So it could have been, they could have used the tramadol. Yeah, now that I'm kind of sitting here working through it, that's a possibility. And maybe Garth would not have heard anything. Possible. That's possible. All right. And I still think that's very interesting that that Tammy said that the guy with the paintball gun reminded her of Garth, that she actually said she thought it was Garth. And then the person ran around to the back of the house. And that's a little confusing to me because isn't Alex Cox looks like Chad Daybell, right? They're both very tall. And I don't think that Garth is tall like that. Now, maybe I'm wrong about that. I may be wrong. But that is what she said, that she initially thought that it was Garth with the paintball gun. It has aspects of aspirin. You can't take it if you're allergic to aspirin. All right. Tramadol is on my list of never again painkillers. Hallucinations. Oh, my God. I saw a marching band walking through my walls and came close to falling down a flight of stairs. That's terrifying, Cheated No More. I'm thinking you would have been angry after watching Dr. Lewis's pathetic psychological evaluation of Leticia. It was disgraceful, unprofessional, and agenda-driven. DB, I'm with you on agenda-driven. Yes, I'm with you. All right. So any other comments about Lori? I think I was prescribed tramadol after gallbladder surgery and puked it up. That it is notorious for making people sick to their stomach. I mean, opioids are too, but tramadol is much worse than even like a like a, like a low level, not Percocet, but what is it? Hydrocodone. The lower dose opioids are they do make people sick. Like with morphine, you're about guaranteed to vomit. It's a bizarre thing, but tramadol is notorious for people getting nauseated. It's hard on their stomach. But I had not heard of the hallucinations. That's very frightening. Very frightening. Okay, so yes. Okay, so Dorothy Lewis. Dorothy Lewis, and now let me take I need to take Lori's picture down. And I look terrible, y'all. I apologize. Let me find something else to put up. We'll put that up there. Okay, now then. So in the Leticia Stauch trial for the murder of Gannon, Dorothy Lewis has been on the stand the last 2 days. Now, she is an American psychiatrist. She is educated at Radcliffe College. She got her medical degree from Yale University. So, those things are very impressive. And she wanted to be a psychoanalyst. She actually did invoke the name of Sigmund Freud on the stand today. I was aghast. I said, what? What did she say? Did she just say Freud? Oh my gosh. Okay, so that's number one. Freud was, he brought a lot to the table back in the day. He was the beginning of this psychodynamic connection between people's behaviors and early experiences in life. And he did great things. Now, he was a living, breathing narcissist, I think you'd be safe to say. But he was brilliant. But then, he developed a little drug problem. And the more drugs he took, the weirder his ideas got. And so he kind of, went off the deep end. But he is the single most recognizable psychologist, psychiatrist, mental health academic. He's the most recognizable name historically of all time. If you go up to anybody on the street and you say, name 3 psychologists or 3 psychiatrists, they're going to say Freud. He's going to be there. Now, his daughter, Anna Freud, to me, her work was much more usable. It was far more applicable. His work initially was quite interesting. He provided structure for a phenomenon that was quite new, and people were trying to begin to understand it. But things went off the rails. Okay. He got cancer. He began using cocaine. There were a lot of things that went wrong. And his ideas were very self-serving. His later ideas were very self-serving. If you go back into his early life and you learn about him and the things that he regretted about the way he himself grew up, the mistakes his parents made, then you can see this direct line between the mistakes that his mom made with what he thinks damages people, like the whole Oedipal complex stuff. Now, that has utility, don't get me wrong, but, I'm a good old-fashioned behaviorist. I practice CBT and then dialectical behavior therapy. Psychodynamic issues are there, but for the most part, people just want to feel better. They want to perform better in life. They want to feel good about who they are. And people don't have enough money and or time to lay around on a sofa for 3 years and go back and explore the deepest recesses of their memory. And that's what psychoanalysis requires. You know, it's a big deal. And it's not, I'm a little even hesitant to say, is it even effective? Because I've seen a lot of people do really well and change their lives and turn things around by making peace with the past and accepting it, and then figuring out their new goals and direction. And then they take off with no kind of guilt or, feeling like they have to drag baggage into their future with them. I'm a big believer in healthy living and positive psychology. It's very effective for a lot of problems. And yes, there are some things that really require kind of a psychodynamic, focus, but that's not everybody. In fact, it's a very small, percentage of people. So Dorothy Lewis wanted to be a psychoanalyst, and that's very telling. She is a graduate of the Ethical Culture Fieldstone School, Radcliffe, and Yale. So she is a child psychiatrist. She is a professor at Yale. She was. So her research has really focused on trauma and the results of trauma. And she sort of stumbled into this multiple personality disorder, now identified as dissociative identity disorder in the DSM-5. She is in an interview saying that her colleagues have laughed at her for decades. She says that in an interview that's available on YouTube. She recognized early on that her focus on DID, or at the time, multiple personality disorder, that the way she was conceptualizing it, many, if not most of her colleagues not only disagree with her, but they laugh at her. So this was not a new experience for her today. Let me see if I can. Sorry about that. So let me find the he discussing MPD way back then. Thank you, Sammy. You're a sweetheart. Who is the he? I am one of the people who hallucinates. Okay. You say he discussing MPD way back then. Sybil was, I know, Coinky Dink. I was in shock. This was not a good day. This was not a good day for Dr. Lewis. Yep, it was not a good day. All right, now then, let me see if I can get that video. I watched it several weeks ago. Let me see if I can find it again. We'll watch a little bit of it because it is quite interesting to see her outside of the courtroom. She is a character. She's unusual. Her mannerism. Now, I know she has Parkinson's, and that gives a strange tone to her voice. But no, she's a little bit peculiar. Should I say unique? She's a character. All right, so Dorothy Lewis, BID interview. I think it was called an interview. Let me see. Where's the guy that interviewed her? Here it is. Good. Okay, I think I found it. Yes, here it is. All right, so I need to share it. Okay. All right, I'm sharing the video now, so hang with me. Hold on. Okay, I need to take my picture down from there. Okay. Good. All right. So this is Dorothy Lewis. And she made, in this video that we're about to watch, she does make the comment that she has been laughed at. Those are her exact words. She has been laughed at for decades. Her words, by her colleagues, other psychiatrists. Okay. Now, she may have been laughed at by other psychiatrists, by her colleagues. However, hear me loud and clear. She is a professor of psychiatry at Yale and New York University. And New York University is just as impressive, maybe more so than Yale. Okay. And then she's got this focus on trauma and the resulting dissociative identity disorder. She is an author of a book, Guilty by Reason of Insanity, and she collaborated with a neurologist, Dr. Pincus, Pincus, I believe. Now, she was also married to another psychiatrist, Dr. Lewis, who is Melvin. And, I've read his stuff too, because he is a child psychiatrist and is also a professor at Yale. So she is a brilliant woman. Make no mistake about it. I know that a lot of people had some negative sort of reaction to some of the things that she said today. But the reality is that she is brilliant. She is smart. She's, all those things. But I think the problem is the way that she's choosing to conceptualize this issue related to DID and criminal violence. So, she says that if you have brain damage, this is another place that she lost a lot of people. She talked about brain damage at length, but she failed to make that connection to childhood trauma. Now, I knew what she was talking about, but a lot of people wouldn't have recognized, well, why is she calling it damage? Why is she calling it damage? So if there's a book called The Body Keeps Score, not by Dr. Lewis, that due to plasticity and the way that the brain changes and learns, and this is a physical change in the brain, when a young child experiences trauma or violence, the neural connections are actually different than a child who grows up in a home that is loving and peaceful. Those neural connections, the differences in the physiological structure of the brain as a result of trauma, increases emotional lability for the person in adulthood, increases emotional lability, poor judgment, their high impulsivity. They can't, depending on the types of neural connections that are formed, what she's calling brain damage, I call it restructuring the architecture of the brain. You can even get psychosis and paranoia. She tried a couple of times to make a connection between schizophrenia and childhood trauma. I don't think that went very well, because there is a genetic component that's measurable. But overall, all in all, she and her husband working together, doing research, treating patients and whatnot, she developed this very unique fringe belief that based on trauma, the brain is damaged. Again, I say that it's an architectural change in the structure, that the kid grows up then with an ability, a special ability to form fully functioning entities that are all different from each other. These are her idea of dissociative identity states. All right. So you could realistically have someone called Jake who thinks he's a Russian spy living in the same body as Twinkle Toes Tiffany, who thinks that she's a ballerina at the, New York Met. I don't believe that. And I don't believe that because I'm a behaviorist, because we are who we are based on our experiences that we've had in life. And the only way a person is going to ever learn or know how to speak Spanish or Russian or Mandarin Chinese is if you have learned it. So I don't know how you have one person just spontaneously develop the ability to speak Russian. That's just absurd. It's just silly. Can't happen that way. Now, I am a believer in dissociative states. I think you have to agree to that. Because you can see it when it happens. Like you can watch a person dissociate, but this is not a fully functioning person that is taking care of their hygiene and they're getting up on time for work and they're achieving at a acceptable level of performance. That's not what the dissociative state is. The dissociative state is that the person is being exposed to horrific trauma or a trigger for that history of terrific trauma. And the dissociative state is sort of this protective blanket that says, no, this is too much. We can't deal with this. And the person will withdraw. They don't just suddenly, like a light switch flip and then suddenly 1 minute you have this homeless person named, I don't know, Gerald, who's lived on his streets the whole life, and then a switch goes off and then he jumps up and changes clothes and becomes a doctor. Not happening. That's not how the brain works, right? So her views it has not gotten her a lot of respect from her colleagues. Her colleagues feel like that her writings are a little bit more fantasy and fiction than a reflection of real scientific inquiry. And I'm not taking a position on either one. She's a professional psychiatrist from Yale. I would show her respect and deference. But for me personally, I'm a skeptic. Now, Dr. Lewis is on record as being, well, she is really against the death penalty. She's against the death penalty. She doesn't believe that the death penalty works as a deterrent, which a lot of people said that's why we have the death penalty, to try to scare people from killing others. She doesn't believe that that is effective. And so she's got some very liberal views of the legal system. I just want to leave it at that, because we could be here all day long talking about, she just doesn't, she thinks that we can take hardened criminals and we can treat them sweet and nice, and then they'll be, they'll get better. And perhaps that may be a result of the years, the type of education that she was raised with. The whole humanist movement was very, very strong when she was being educated at Radcliffe and Yale. That could have a very powerful effect on her worldview. But I think what we need to remember as we listen to, her testimony in the Leticia Stauch trial is that, number one, she is absolutely against the death penalty. So much so that she's spoken on it and she's written about it. She is against it. She thinks that mitigating factors must be considered by judges and prosecutors, and that if jurors just knew the mitigating circumstances, that they could be kinder and more understanding of the criminals. She thinks that punishing, how should I say this? Punishing criminals, that makes society overlook the real cause of crime, which is what? Society. So you see where I'm going with this. She may have been fighting hard for Leticia, not because she thought that Leticia has multiple personality disorder or DID, but because she really wants to protect Leticia, that she feels like Leticia has been mistreated all of her life, and that if she had grown up in another type of setting, that she would have been a different kind of young lady. And that's just not why she's in that courtroom. There's a little boy that is dead. She abdicated her role, in my opinion. This is only my personal opinion, 100% my personal opinion. She abdicated her role. Her role was to assess Leticia and answer the question, does Leticia, the various data points that I've collected throughout the history that I can get on her, does she present historically and today, does she present with two distinct identities and or personality states, and how long have those two or more people or identities been inside of her? Is there a observable, documentable pattern of her perceiving two or more different people, other people relating to her like there's two or more people, or that her performance in the environment or the way she treats herself, two or more different people? Dr. Lewis didn't do that. She didn't even speak to Leticia's family. There should have been school records collected. Anything that she could have found where someone was either documenting Leticia's behavior or activity or telling stories about Leticia, historical from elementary school and whatnot, that would have given her the ability to perceive or to lay out what would be considered an enduring pattern of behavior that would suggest two or more entities or identities within this one person's body. She just didn't do that. The DSM says, that you're looking for this enduring pattern of behavior that would suggest that a person is not behaving in a static manner across settings, that they are changing. The change is easily observable by others, or that the person themselves perceives the change. And these can be changes in their affect, the way they hold the muscles in their face. It could be changes in like memory, like maybe they claim to remember things that there's just no way they could remember, or say that they don't remember a damn thing when they were right there living and breathing the situation when it all happened. There can be changes in behavior, like how they walk, how they hold their hands when they're talking, the way they dress. Are they hard of hearing? Do they like to eat chocolate or fried chicken? Changes in intelligence, intellect. Like one day you test them and they're testing out at about, 85 on a Wechsler. And then you go back and you test them the next week and now they're popping out 142 on the Wechsler. it's crazy. But nobody did that. Dr. Lewis did none of this. She was not able to lay out any level of objective measure that would establish this enduring pattern or the belief of an enduring pattern of, the signs and behaviors and evidence that Leticia operates in various settings as at least two or more different identities. She was just simply not able to do it. She just couldn't do it. They had this very bizarre exchange where they were talking about drawing the clock, correct? So they're talking about drawing the clock. Well, listen, guys, she's talking about one item on the Fulstein mini mental status exam. That's what she's referring to. And they said, well, what do you call this measure? What do you call this? And she said, oh, well, I just call it the clock. You call it the clock, Dr. Lewis? Really? Anybody knows what you were referring to that is in the medical field. The nurses, the RNs on any floor in a hospital, they know how to give a Fulstein mini mental status examination. And part of the Fulstein is to do clock making. And it's just a round circle. And then you say, okay, it's 10 after 3. Draw the clock hands so that it's 10 after 3. It's not a clock test. It's just an item on the Fulstein, right? Hey, cheated no more. Oh, thank you so much. You're a sweetheart. Thank you. So look, she did not lay out an enduring evidence of an enduring pattern of two or more identities operating in different environments. She failed that. She did not do that. She did not show a change in sense of agency. She didn't show a change in how Leticia views herself in any given situation. She could have easily have done that. How many times has Leticia been married? Or at least how many boyfriends has she had? Go get statements from each boyfriend and say, okay, tell us what Leticia is like. And then you've got 3, 4, 5 different people going, oh, okay, well, she was very quiet. She was a great cook. And, we never had sex because she hated sex. But then you talk to the next guy that she was with, and he's like, oh my God, I think she had something wrong with her. All she ever wanted to do was have sex and cook. Are you kidding? Her idea of cooking is the McDonald's drive-thru. I don't even know what you're talking about. And then you go to the next boyfriend or husband and you find out about them, about cooking and sex and those types of things. And the guy goes, well, I don't know. Food wasn't a big deal. She's like this big health nut. And so all we ever had was salads and fruit. And we didn't really often think much about food. We drank a lot of water. And she loved to have sex outside under the moon. Do you see my point? These are kind of basic primaries. Food, sex, task approach. So none of that was laid out by this professional. It really, it was hard for me to listen to because I thought, what are we doing? Like, what are you doing? You're just sitting on the stand telling stories. And they're not even stories with any sort of support under, empirical quotations or citations, none of that. It was very sad. It was very difficult, to watch. It really was. I'm not going to say any more than that. I think there may have been some other stuff happening, but still, it was really hard to watch. Anyway, so this is the basic, criterion is to establish this enduring pattern of multiple styles of interacting across environments and self. And there's lots of different ways that can, present itself through memory, cognition, perception, behavior. Affect is always a big one because it's usually not it's subconscious. So that's your first criterion. The second part of this is this issue of amnesia. Now, amnesia is required. And the reason that amnesia is required in this diagnosis is because you're laying out the foundation, or people like Dr. Lewis are laying out this theory, this belief that you can have one biological body with two or more individual, fully functioning identities. So they have to switch, right? One has to be in charge and then the other. Well, if this is the case, you can't divide the brain up into 2, 3, 5, 10 different people. The brain is very intricate and a little bit haphazard in how memory is stored. Memories are stored all over the brain. They're not in one centralized location. They're all over the place. Even language, while there's a great deal of focus research-wise, like on Broca's area and Wernicke's area, the reality is that there's lots of different areas that can be affected, and if affected, it will interfere with language or comprehension of language. So the brain is very, very complicated and intertwined in its abilities. So how are you going to divide up the brain into 5 fully functioning independent people? No, there's got to be shared resources or it can't happen. The person can't live without shared resources. At the very least, they got their heart has to beat. So they have to have a shared brainstem at the very basic level. So that's number one. According for her theory, or not her theory, her belief on multiple personality disorder or DID, the belief for that to be operating requires that when one of these entities is in control, then in order for the other identities not to change, not to be affected, they have to not be aware. Otherwise, they have shared memories. And if you have shared memories, you have integration. And if you have integration, you're not multiple people. So it is a flawed theory based on the biology and the neurology of the animal. It is the doctors, the medical doctors have failed to conceptualize how this could even happen, right? So amnesia. If we go with the assumption that Dr. Lewis's ideas are possible, then that assumption we have to agree that the only way it can happen is if there's amnesia. That's the only way it can happen. So without amnesia, you really don't technically have DID. There are other diagnoses that will work. It's not just because we say DID is probably not an accurate condition, the way it's described, it doesn't mean there's not other things that can fit. And I'm not even talking about psychosis, but there are other conditions that would still account for the symptoms, but be maybe a little bit more rational and provide a more fruitful avenue of treatment, so to speak. All right. So amnesia must occur. And the DSM says that, amnesia is basically gaps in everyday living. It may be a couple of hours. It may be a minute or two. It may be a whole week or a whole month of not knowing where you've been or the things that you have done during that time. And if you consider that most people, when they talk about, multiple personality disorder or DID, they describe dramatically different personalities. And so, if you are at your heart, you're an introvert and you love books and you're an accountant, it's not likely that you're going to suddenly become Bam Bam, the stripper with triple D boobs. And so how traumatic would it be to suddenly come to your awareness as an introverted book reading accountant, and you're in a strip joint with a bathing suit on? How would you manage that? It would be traumatizing. It would be terrifying. So these episodes of I'm using hyperbole to make my point, but let's say this. Let's say that you have a 5-year-old or 6-year-old child at school. You have to go pick your child up from school, and bam, bam, the stripper takes over, and it's suddenly now 8:00 at night, and you're up on a stage stripping, and you think, oh my gosh, who picked my child up from school? Terrifying, right? Absolutely terrifying. So amnesia, being defined by the DSM as a gap of missing time or everyday events. And again, it could be a matter of moments. It could even be as much as a month or more. But it has to be there in order for this to actually express as they've theorized that it would express itself. Now, the old way of diagnosing the amnesia was generally, well, it was more focused like on trauma, like you would see like with a PTSD type situation, where someone would withdraw, they would dissociate and pull back, and because the situation was too uncomfortable. The new DSM-5 is saying, no, it can just be everyday events. You don't have to be in a traumatized state. You don't have to experience a trigger. If you have DID, you can just decide you're going to be Bam Bam the stripper and have some amnesia, missing time. So I'm owning it. I'm a skeptic. I'm owning it. Okay. I could be wrong. This could be very real. It really could. I get that. But I'm laying out to you the things that I know that cause me to say, maybe we haven't really defined this very well. Maybe we could do a little bit better with the diagnostic criteria if we need to, because there's a big mismatch between the way that Dorothy Lewis is conceptualizing DID and the reality of the neurology of the human being. Now, most people with serious mental illness, obviously, are distressed. They're having trouble functioning. Mental illness is very difficult because it's affecting your brain, and your brain is what guides you through most of your events in your day, right? So, like any serious mental illness like schizophrenia or bipolar or whatever, it is upsetting and troubling. There are results, there are impacts on your daily functioning. I'm sorry that my little dog is barking so loud. Sager, no, you've got to stop. You're so loud. Thank you. So part of this whole DID is the person has to be distressed by the impact of their disorder on their lives. We do not think that there is any, or we shouldn't consider that there's any sort of cultural or religious influence that would be used as criterion for DID. I think we've seen, though, that part of the way that people are raised, that can have a big effect on how open they are to believe things that might be considered metaphysical or magical. If you're raised in the Mormon religion, then that idea of visions and dreams, that's something that is embraced by, I think, most of the community. But, you know, if you're a good old fashioned Baptist or Methodist, you probably, or an atheist, you probably just don't think that magical things are happening all the time. So again, with DID, no cultural, religious, influence in terms of the diagnosis. And like all rule outs, the symptoms cannot be better explained by the direct physiological effects of a substance. That your blackouts can't be because you drank a fifth of vodka, right? All right. Now, also seizures. At the same time that you would say the symptoms or the criteria that you're counting cannot be better explained by the direct effects of a substance, you would also say that it can't be better explained by a general medical condition. That if there is a medical condition that would better account for those symptoms, then you have to go with the higher diagnosis, which would be medical, such as complex seizures. That could account for some of this behavior. And there was a little bit of discussion about seizures in the Lori Vallow case, but not related to Dr. Lewis and Leticia Stauch. Now, how many of you think that Leticia Stauch has adopted this body language of what's the scary lady on the internet? Not Lolo. What's her name? Oh, I can't remember. I've lost it. Momo. Momo? I think she looks like Momo some days. I'm really sick of these Morgans. So Momo and Leticia Stauch are looking, thank you, sweet tea, looking very curious, right, Charnel? Welcome, misunderstood. Yeah. It was like I was back in my body, seeing through my eyes and looking at the road. It was shocking. I had no idea who was driving. It was a total blank. That's terrifying, Cheated No More. That's terrifying. Hey, Skitty Nona, how are you? Good to see you. Okay, so let's take a listen to Dr. Lewis and let's just see what we think compared to what we heard yesterday and today. Where am I going? I think y'all can't hear, and I didn't have my headphones.
And I'll say, that's not a scientific term. It's not a medical.
I've been quarantined for 7 months here.
Sorry about that, people. Y'all are awesome.
Not to use that word openly. Well, thank you so much for joining me today to talk about Crazy Not Insane, the new HBO documentary. I guess I want to start with, are people born dangerous? Are they born killers?
Can y'all hear now?
No. Simply no. I've been working in this field for several decades now, and they are not born dangerous or evil. I mean, my colleagues will say, Dorothy, what about evil? And I'll say, that's not a scientific term. It's not a medical term. It's a religious term. And it's not up to me to say one thing or another, but no one is born that way. Or else we are all born with the capacity to be violence. So there's nothing that distinguishes us from day one from the people who later become very violent.
Well, we've all had that impulse during our lives that we want to kill somebody, and we use it as an expression and all that. What is the factor that makes someone cross that extra line that actually does commit a murder?
Mm-hmm. Well, I can only tell you from my experience and our team's experience, and I learned it over years. It was not anything I knew to begin with. It's not taught in psychiatry training, what makes people violent, so that it's a discovery as you go along. But over the years, it looks as though just about, you have to say just about everyone, because there's always an exception, but just about everyone who becomes extraordinarily violent repeatedly. We're not talking about one fight in a bar. We're talking about recurrent aggression.
Now, right off the bat, right there, she says, well, we're not taught what makes people violent. She says that. And I'm thinking, of course we are. Yes, we are. What do you mean we're not taught what makes people violent? There are a lot of reasons that people can become violent. There's a lot of reasons. Sometimes they're violent because there's an organic problem where there's something wrong with the enzymes or the structure of the brain, and the limbic system isn't cooperating well, and the person has way too much norepinephrine, and they can just be violent. They can be impulsive. They can be multiple layers of stress. If you have somebody that's been under a lot of stress and then more things happen and more things, it uses up their available level of coping skills, and eventually they can explode because they don't have anything else to do. They feel out of control and they begin fighting for survival. There's also reactive violence. People that sit and take it for years and years. They're getting beat up by their husband or their wife, and they don't say anything, and it goes on and on and on. And finally, that instinct kicks in to protect themselves, and then they act out. You want to watch somebody get violent? Take a woman and try to hurt her child. You'll be in trouble, I promise. There are many things that make people violent. I don't know why she said this. It's not right.
Just about every one of them has been raised from early on in a family where there's extraordinary violence and where he or she experiences incredible abuse. With the guys, the girls too. Sexual abuse is very, very common. And in the course of this ongoing torture, the individual unconsciously sort of flips out, and it's as if someone else comes to, quote, take the pain. And I've had more than one alter when I'll say, well, what do you do for so-and-so? The alter will say, I took the pain. The other vulnerability that I think you need, because probably most abused people don't kill other people, but also there is a kind of brain abnormality. It can be biochemical, it can be a predisposition to a serious mental illness, to mania, to schizophrenia, to certainly paranoia, and or actual brain damage that coupled with this upbringing in an incredibly abusive home create very very people.
And
you
said
get
you think
frontal
you
lobe damage. You can get very violent
condition?
People.
Oh God, I've never thought of that.
I don't know if y'all heard that because I was talking, but he said, "Oh, so is homicide a clinical condition? What? What is homicide a clinical? So what are we going to do? Are we going to now begin to take every aberrant behavior where someone creates a crime and we're going to excuse it because we can give it a diagnosis? We can't do that. That it'll be anarchy. We've got to, it's okay to be able to name these things. It's okay to be able to understand why they happened or where they came from, but it does not absolve the person over their responsibility. It just doesn't.
May I think about that?
Sure.
Give me your address and I'll think about it and talk about it and
Okay.
I'd let you know, because it had never, ever occurred to me.
No kidding.
Yeah.
Well, you've seen over 22 serial killers. Is there a pattern, or are each unique? Other than them being a serial killer, do they have their own unique pattern in their history of why they kill?
Yes.
Yeah, of course. But, you know, when I think of Marie Moore, who's mentioned in the film, she was terribly abused by her father, and then and she also had some neurologic and some psychiatric disorders, but they can vary. And you know, it's wonderful. Different families abuse differently, but by and large,
yeah, that was an
the recipe
interesting
for
comment
violence
she
seems
just
to be
made.
early.
If you didn't hear her, she said different families abuse differently. But Dr. Lewis, I'll challenge you and go one step further. Different cultures abuse differently, don't they? It's not just the family. That's why you're getting into dangerous territory here. If you begin this campaign of giving a diagnosis and then using the diagnosis to absolve people of their responsibility, that is a very slippery slope to get out on. It's not just an individual abuser or a family abuse pattern, but culturally there are abusive patterns. I lived many years in an Islamist nation, and the girls were heavily controlled and not allowed to spend time with the opposite sex, even in college. And if they were caught even speaking to an unmarried male, then their parents would punish them with things like this: taking a fresh lemon and holding the girl down, holding her eyelids open, and squeezing the lemon into her eyes. This was a direct thing I knew. This really happened. This girl, same one with the whole lemon juice, she was tied to a kitchen chair. This was her dad and her mom and some uncles. She was tied to a kitchen chair, and then they lifted the chair up so that the ceiling fan could hit her in the head. And this was all done because she met a boy. I'm talking about they went and met each other near where the pyramids were to sit and talk together. And somebody that knew the family told the dad that she was there instead of being at work. So, you know, I fired a whole lot of people that day for abuse and said, you know, I didn't care how they did it in Egypt, that I was American, and in America, we don't, you know, assault our young ladies like that it was not acceptable. And so everybody got fired but her. So she got to keep her job because she was the only one that was bringing money in. But you know, so it's not just that every family has an abuse pattern or that every individual abuser has their own unique way. We also have some serious cultural influences that would dictate what might be considered abuse or what may not. What may just be looked at as a like a control contingency, like a punishment, an acceptable form of punishment might drive abuse. I mean, you got to admit it's pretty awful to think about taking a stick and beating a child across the legs. And yet how many generations did that go on before it finally, you know, stopped? So, you know, we all do want to live in a kind and gentle world. I understand that. Utopia is a great thought, theory. The problem, though, is that you fail to account for certain basic personality characteristics where if you live a passive lifestyle, if you have a community that's set up in a passive exchange, it just leaves wide open space for people to come in and take over the community. So there will always be the need for some form of protection, always. And that does away with your utopian idea of life. And if somebody hurts another person in the community, they need to be punished, and the community needs to be protected from them. So I get what Dr. Lewis is saying, and she is a brilliant academic, and she is looking at an idealistic world when she has her ideas. But the takeaway is she is dramatically against the death penalty. She is dramatically against prisons. She doesn't like punishing criminals because she thinks that stops the culture from actually paying attention to what creates the criminals and fix that instead. So there may have been some ulterior motives for her testimony, or let me say it this way, the manner in which she testified. But I do think she was still consistent with her identity, the things that are important to her. But at the beginning of this talk, I did talk about the need for establishing, like at this, the enduring pattern of behavior of two or more entities. You can't get away from that. She needed to have had, what we call receipts. She needed to have collected data that could actually be shown and discussed. Well, here's what boyfriend number 1 said about her proclivity towards cooking and sex, and boyfriend number 2 and the way she behaved with him, and boyfriend number 3 and the way she behaved with him, to establish a very real difference in behavior that was happening before she needed an alibi. And that just wasn't done. There was absolutely no discussion of that critical criterion for amnesia. She simply just ignored this issue of, a history of missing blocks of time for Leticia. She did not talk about Leticia being disturbed by these multiple entities. In fact, it was kind of different. The interviews with Leticia talking about Maria Sanchez and whatnot, it was almost like that she liked them, that she was happy that she had these people. No, not disturbed by it. It was very strange. And then, I don't think we heard anything on whether or not this could have been the direct result of a substance problem. We didn't hear anything about that either. I also didn't hear anything. Y'all correct me too if I'm wrong. Correct me here. I didn't hear anything about Dr. Lewis giving her any measure at all for malingering. Did she? Did y'all hear any testimony that there were any tests of malingering that were administered? I don't think so. The only test that Dr. Lewis mentioned was the Fulstein mental status examination, and she did not even talk about that with the name. She called one item the clock test. She said, "Oh, well, I needed a neurologist because I needed to test some of her neurological functioning if something's wrong with her optic nerve." Listen, y'all may not know this, but guess what happens when somebody goes to a neurologist and they need to be tested to see if there is disruption in cognition? Guess who does it? Me, a forensic psychologist, a neuropsychologist. That's who does the testing to find out. When she says that she doesn't have any tests, of course there are tests. Weschler has a test. There's any manner of neuropsychological test. So this was a really unusual It's a really unusual testimony. And at one point I thought, wait a minute, maybe she's here as like a fact witness, where she's just going to get up and educate the jury about what is DID. And basically she doesn't even know Leticia Stauch. She didn't talk to Leticia Stauch. She doesn't know anything about what crime Leticia created, that they just needed to hire someone to come up and say, what is DID? And then the expert gets up and says, well, DID happens, and then occurs in this number, blah, 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 blah. That's not what happened. We actually saw video of her interviewing Leticia. So I don't know what it was. I'm at a loss. But I felt terrible for her. And I want, she is brilliant, and she is a very, very well-respected doctor as well as an academic. She's teaching with Yale. She's teaching with New York University. Her husband, Melvin Lewis, he's dead now, I believe, but he's a very well-respected child psychologist or psychiatrist who wrote many, many books on the subject of child development. It was very hard to watch. It's sad. It was sad, it was sad. But anyway, so any questions? Y'all think of a question, and let me let my little dog out, and then I'll answer your question. Okay, I'll be right back. I'll let the video play while y'all are thinking of a question.
Really ongoing, intolerable abuse, and then some intrinsic vulnerability like brain dysfunction or psychosis or something like that.
And you have interviewed over 100 murderers, death row inmates, some of America's most notorious serial killers, Ted Bundy. Have you had many sleepless nights? Do you bring your work home with you?
No.
How do you manage that?
Well, it's not conscious. Whatever I do, it's not really a conscious act. It's somehow you learn to cope. And but even when I worked at Bellevue, I remember a colleague of mine said, Dorothy, I see you go from a very serious interview to then maybe teaching a course or something. And how do you do it? And I'm not aware of that, but I think that I sort of intrinsically, I have the ability to shelve the very last thing that happened and move on. Later I may think about it, but it's not a choice, it's a habit.
That's odd too. So compartmentalization, or what she's calling shelving, that was sort of a kind of a little tool, a cognitive tool that was discussed back in the 80s and 90s, I think. But ultimately shelving or compartmentalization would be kind of the same thing. And compartmentalization has gotten a bad rap. It's kind of got, right, Annette. It's gotten a bad, kind of a bad reputation among counselors. But as a psychologist, I will say that the ability to compartmentalize and then go on and fulfill your requirements, do what you need to do without the shocking struggle or the problem that you're dealing with, without it being able to affect your performance, that is actually the mark of a very healthy person. Someone who is able to get angry about rightfully angry, right? Something that's rational and logical, to get angry, but to be able not to show that anger, to be able to continue your performance properly for that setting, and then deal with your anger later when you're in the right setting. That's not a bad thing. That's a mark of a really healthy person. Same thing with you're about to see, let's say you're a doctor and you're about to see a patient, and you get the information that their mom hey, doctor, such and such, your mom just died. Well, there's this moment of, oh my gosh, I can't abandon my patient because I have an ethics code, but I also can't do anything about the fact that my mother's just passed away. And so for the next 45 minutes or the next 30 minutes or whatever, that doctor compartmentalizes the private information, sets it aside, goes ahead and cancels the rest of the day, sees the one patient who's still in the office waiting for them. And then once that is gone and all the professional stuff's taken care of, then they can be a person and go and tend to the family and do what they need to do. Now, you're not talking about compartmentalizing and never dealing with these issues. That is unhealthy. But to shelve something for a moment while you complete what you need to do, that's perfectly healthy and optimal. People can't just go around having breakdowns every day. All of this, oh, I don't feel safe. This is not a safe space. There are people that do need to find safe spaces, and we do try to accommodate that. But I don't think it goes to the extent of that. You're talking about a whole college of 35,000 students that require an entire floor on a building as a safe space. You shouldn't have that many people breaking down. You know what I mean? So we need to, stability is important. Hey, Dr. Latina, that's exactly what happened when my father died. I was in the middle of taking care of patients and I got the news. I was devastated. I walled off my emotions until I had seen 3 patients. Exactly, Dr. Latina. And it wasn't unhealthy that you did that. It was a mark that you're a very secure, a very intelligent, a very stable person, and you were able to take things in a very linear fashion and check those boxes until everything could be taken care of. So, other people would say, oh, that's compartmentalization. You shouldn't do it. It's so unhealthy. It is healthy to be able to maintain control, but still problem solve your way through it until you can get into an environment where it's appropriate to, be private and grieve and do what you need to do. Yeah, absolutely, Dr. Latina. Absolutely. So Dr. Latina, did you see Dr. Lewis today? I would wonder what you thought. Let me put a link up here if you want to come up. I had a hard time with it. I'm not gonna lie. It was. I felt very bad for her. I felt really, really bad. Okay, let's see. Let me get a link here. Copy. Paste. All right, Dr. Latina. Wait, what's it saying? YouTube doesn't support comments on private videos. So it's not a private video. What a weird thing. That's strange. All right. They should have given me my order. Mess too clean. Who threw a plate of food? Zelda. I was naughty. Proved they got my order all mixed up. They didn't care, so I tossed my whole plate of food against the wall. Zelda, you were stressed. You were in distress. I'm sorry that happened. Okay. All right, Dr. Latina, I'm going to add you to the stream.
Hi, I've been MIA for weeks. I'm sorry.
No, you're fine. How are you?
I am actually in bed with diverticulitis right now.
No.
So I'm not in good shape. Yeah. I've had this a couple of times in my life, but
Oh my God.
So
I'm so sorry.
Yeah, it's been a rough couple of days, but my daughter has been bringing me ice pops and she just made me a bouillon soup. So I'm good.
Yeah. Oh,
well, I'm not here to talk about me. I'm here to tell you I listen to you all the time. I just haven't, I haven't piped in.
Yeah.
But I've been following every one of your commentaries and I just love them.
Thank you.
Yes, on the whole Coburger and the whole 9 yards, man. But this woman, I'm sorry, with all due respect, I think she needs a dementia workup. She could not follow.
Yeah.
She truly couldn't follow the thread
Yeah.
of the players in the story.
Yeah.
So how could she then do an adequate evaluation? It was really sad. It made me kind of sad.
I felt very sad.
Yeah.
I felt very sad watching her. She's had a brilliant career. Melvin Lewis, her husband, was really the literature that I was most familiar with, just
Yeah.
with my background with the children and stuff.
Right.
But she was not. This was not her. She's not in her prime. Let me put it that way.
No, it was really embarrassing. I mean, honest to God, Jot, I was embarrassed for her. I really was.
Well, so what do you think the effect on the jury was? Because I think there's not really been anybody that said, well, it was okay. Most everybody is feeling like, oh, this was a train wreck.
It was a train. I'm sorry. And I've been on a couple of channels because I've been in bed for 48 hours. So of course all I've been doing is like watching you all. But I was on a couple of other live channels, some gal, that Grizzly, whatever it's called, and it was hilarious.
What did she say? I love her.
I love her too. She was
she was like, what is this lady saying?
She was like, she's saying things like, is this a seance? Is this delirium?
Oh Lord.
You almost needed the gallows humor so that you didn't cry.
Yes, because I agree.
One thing I wanted to know your opinion on, Jot, because I felt like she was on the right track. The audio was terrible today, but she was, from what I could glean, there were points when Dr. Lewis was kind of teasing out some stuff, but instead of, I would have done it differently. First of all, I would never have had my son and the attorney in the freaking room, and she's asking,
what about HIPAA? Like what? Like what the hell? I was like, wait, what are you doing with those? Why's your daughter there?
I was just like, what is going on here? And then at certain points, wait, I've got the giggles. At certain points, she turns to like her son and the attorney and says things like, "So what do you think?"
I know.
It was horrible. But wait, there was that. The other thing I wrote on my little thing in Grizzly, I wrote something like psychiatry, like when I did my internship in psychiatry with it was a year of inpatient locked wards. Okay.
Yes.
Day one, we were told psychiatry 101, never wear a scarf or a tie.
Thank you.
And I'm thinking,
why? Because
it's an outfit.
Because the weapon, that's why.
Exactly. I mean, and she's got her cane next to her. I'm thinking this girl could yank her in 2 seconds.
And knowing Leticia and her history, the girl is dangerous.
She really
just
is.
Explodes.
Exactly. She really is something else. But see, the last thing I want to, and then I'm going to go back to chat because it hurts to laugh. My belly hurts to laugh.
I'm so sorry.
No, that's all right. But at least I'm feeling happy now that I spoke to y'all. So here's my thing, because I was thinking about you while I was watching earlier on the Grizzly. When Dr. Lewis was at certain points, when Leticia had these fake Spanish and fake Russian accents and everything, there was what we call, leakage of truth, right? She's saying,
yes.
I bopped him over the head. It was just one shot. I mean, it was like all there. But she was kind of weaving it with these fake personas or alters.
Yeah.
And see, if I were the psychiatrist or the psychologist doing this, I mean, what I've always been taught is you don't indulge the alter. You don't go finding the paranoid ideation, or you don't go digging for that alter and say, hey, let's talk to that alter. But instead to go back, so Leticia, tell me a little bit more about what happened.
Yeah.
Like go back and talk to the integrated personality of Leticia and try to get the truth from that. What do you think?
So what I would have done first, right off the bat, I would have been going back historically and gathering data.
Well, yeah,
I'm looking for that pattern of behavior that I can lay out and say, look at this, when she was 17 years old, we got two different people that are describing two completely
But she
different
never
people.
she never did that. But what's so sad, Jot, is that one of the first things she said yesterday, Dr. Lewis, is one of the crucial pieces is you've got to look at historical collateral data, like you're saying.
Absolutely.
And that's how you know that there's something to hang your hat on. And she never did that.
No. And then what the hell? Oh, I got a piece of paper. It has an L on it. What? It's got an L. Well, how do we know that doesn't mean left hand in your mock test?
Oh my God. It was like, I think that honestly could be used for teaching purposes. That interview.
You know what? It's funny that you said that, because it was going through my head. This is what you show for what not to do if you're testifying.
Exactly.
And then, of course, the interviews, like you said, that could be used in terms of here's how you do a clinical interview or a good background in history, right?
Or here's how you don't do it.
All right. Yeah, exactly. But even her testimony was just like, oh my gosh, where is your objective data? Did you give any malingering test? Where is the personality evaluations? What did you do with this girl other than to sit and just indulge her ridiculous stuff?
Like people were saying earlier in the other chat that I was watching for freaking 6 hours. You could see what I was doing in bed all day. And they were saying, well, so now take out the tea and crumpets. And it was so bizarre.
It was really, and Leticia, you could watch her body language. You could see her turn toward Dr. Lewis. And in my mind, I could hear her saying, okay, this one I can manipulate.
Exactly. No doubt.
Yeah, she buddied up to Dr. Lewis, and it's like, oh my gosh.
It was horrible. And there was one other question I wanted to ask you. No. I thought what was frightening to me, I mean, I honestly couldn't tell you I'm in Connecticut. I could not tell you right now what the sanity guidelines are, right? But I sure as hell for the state of Connecticut, right?
Okay.
Because they asked her, so how did you come to how in the state of Colorado, Dr. Lewis, what are the requisites? And she's like, I don't know. I'm like, what do you mean you don't know? And then they said, do you have a license to practice? Did you see that yesterday or not?
I didn't see this part.
Oh my Lord. They asked her yesterday, you know how they at the beginning say, well, what was your education? What was this? What was that? And then of course the prosecution got up and said, so what states do you have a license to practice medicine? Yeah. She's like Connecticut, California, and I think she said New York. Yeah. And he's like, so you don't have a license to practice in Colorado? She said, no. Do I need to? I'm not kidding. And then he said, so how do you have authority to
well, now let me say this.
Oh, sorry.
If she's teaching, she doesn't need a license. The license
but you're
is evaluating, practice, right? But if you're evaluating, that is practice.
Exacto. So like, in other words, so I do court ordered stuff too, right? And immigration evaluations and stuff.
Yeah.
But if somebody's lives in Massachusetts, I can't do it. They have to come to my Connecticut office because that's where I have my license.
Absolutely.
So girlfriend didn't have a license for Colorado, and then she goes on to go, did I need to have one? He's like, I don't know. Why don't you tell me? How do you know you're practicing within the guidelines, and who would oversee you?
Oh my God.
I know. And then she said, well, I guess I could have gotten a temporary one. Duh. But then she goes on to say, but it would cost me $500. I didn't want to spend the money. No, stop. Yeah, it was bad. It was bad. Shot. It was bad.
Oh,
so I didn't
hear the license and stuff. I didn't hear that.
But I didn't mean to eclipse your focus here, because I don't even know. I just jumped on. I don't know where you're headed with this.
Yeah, no, I just had a lot of people saying, what did you think about Dr. Lewis's testimony and the non-evaluation that she did? And so I went ahead and kind of outlined the DSM criteria for DID.
Right.
And how you would establish those 5, conditions, and how Dr. Lewis didn't do any of that. That we didn't hear anything objective. We didn't have anything like she didn't bring receipts, right?
No.
That there was an overall breakdown in just this logical, linear pattern that drives assessment.
Right.
It was a mess.
It was a freaking mess.
Yeah.
And then at the end of yesterday, because I've been in bed, I told you now for 2 days. Day 1 was part 1 for her, and then day 2 here in bed has been part 2 for this woman. And so at the end of day 1, he goes, the prosecutor said, I'm sure your chat, this is all an instant replay for them, but the last question of the day was the prosecutor asking Dr. Lewis, so how is it that Dr. McGregor or something like that, I can't think of the name, and Dr. Torres from the defense side, did not see the altars? And how is it that you were able to call them out and go, come on, Maria, come on out, let's
not
talk,
how it works.
kind of thing. And she, what she says? I don't know. This is the last statement of the day. I'm not sure. Magic? And I think she was kidding, but it's like, no.
Wow.
Yeah, it's deep, man.
Oh, magic.
So I'm going to go back into chat now, but
like Chad's pen.
What about Chad's pen? I don't know about that one.
You don't know about Chad Daybell's magic pen?
No.
Oh yeah. So when he was filling out the application for him to get like his master's degree,
okay,
he's filling it out, and suddenly it becomes hot or glows, or the pen changes and takes on these metaphysical qualities that it didn't previously have, and the voice of God spoke to him through his pen and said that for him to achieve his goals, he did not need higher education or a higher degree.
Oh my word!
That's right.
Well, there's so much. Well, there is so much more for you as a psychologist.
So Warren Jeffs had magic underwear, and Chad Daybell has magic pen.
Oh my Lord! And I guess Dr. Lewis has a magic finger that can point to invisible altars and start talking to them and calling on them.
Dr. Lewis has she has all the magic that she can discern entities that no one else has ever seen before.
But the last thing I'm going to say before I jump off is what bothers me, especially being up here in New England, I get really, really tired. I even see it amongst my colleagues. When they introduce a colleague, they'll say to me, and this woman did the same thing, oh, they went to Harvard, then they went to Yale, then they did a fellowship at Yale, and then they were at Columbia. And I'm like, you know what? Good for your academic pedigree. But
yeah.
Honestly, some of the most brilliant clinicians that I've ever met have trained at sort of state schools or whatever. Yeah, I mean, absolutely. It doesn't, I don't care that you went. And she had the audacity yesterday, believe me. Oh, I'm so upset. Had the audacity to I think this was wrong. I don't believe that Leticia has even a master's or a doctorate. And there's been no corroboration of like transcripts or anything. But ultimately, Leticia said to the doctor, and I think to maybe some other people, that she got it online. Like she went to Capella University online for a master's, and she almost got a doctorate through Liberty University online. Now, I mean, yes, that's not as prestigious as Harvard and Yale, but if she truly got those online, if she did, which I don't believe she did, those are valid institutions. They really are. And I actually have met like nurse practitioners that have become nurse practitioners through some no-name online program out of Georgia. And they're fun. And then, of course, they do their clinicals, right? And they're phenomenal nurse practitioners. So this woman, Dr. Lewis, had the audacity in the court to say, you call that an education? Yes. I couldn't believe it. She's like, she said to the prosecutor, what do you mean she went on and had a good life? You said she got a master's and a doctorate. Well, she got them online, so I wouldn't call that good. And then she said, And you said she got married twice. Well, she married losers or something. I couldn't believe she would even say that.
Oh no. See, there was a lot that I've been working a lot, and I've just been trying to like catch up like during breaks during the day and then late at night. So I, I've been trying to keep up with it all, but so little bits and pieces, I've missed.
Well, those are huge bits because I think it's really audacious to say that you're you married. I'm paraphrasing, but basically 2 loser men.
Okay, well, I will tell you this. Okay, so we get there, people with these advanced degrees and stuff. We're sort of trained to believe that these what should I call them? Old blue blood colleges.
Yes.
You know what I mean? That they're supposedly putting out this higher quality of thought or education or student or whatever. I went to school with someone, my internship was shared with a person who was trained at Harvard.
Right.
And I had several instances where I had to guide them where they were wrong on something. So I felt good about that, I came from a state college. It was an APA accredited program, is a great, program. But I think we do too much of this. Ooh, Harvard, or I think there's too much of that.
There's way too much of it.
Yeah, instead of looking at performance and where did they get their clinical types of experiences and whatnot. University of Pennsylvania is probably one of the best psychology schools that there is, and it gets very little mention. But if Harvard or Yale comes up, people are not paying attention to the training for the psychology. It's just the big overarching Ivy League. Oh, it's Yale. And so she's kind of one of those. She went to Radcliffe and
right.
Yale. And so, you're just getting a lot of that blue blood kind of, the haves versus the have-nots. And I don't think it served her well.
I don't think it did either. And then last thing is that if you looked at, I don't recall that Dr. Torres, who was the young woman who worked and did the other, the prosecution side evaluation. She was brilliant. I thought she was just wonderful. And I remember, I don't recall where she went to her different schools, but I felt like it was maybe in the Midwest or the West. And there was no Ivy League sort of stuff. And this woman was so brilliant and so on point and clear and articulate, except she kept saying dissociative disorder. That did bother me. Yeah. But other than that, she was brilliant. I mean, there wasn't a comparison between the 2 clinicians in my mind. Yeah. So anyway, thank you for letting me share.
No, I'm so glad you came up. I'm sorry though that diverticulitis is a bad deal.
It's bad. I had it like many times. I developed it right at the end of my very, very brief marriage. I will only go into that. And as soon as I served the papers, this is about 4 years ago, I never saw it again. And then this past week I came down with it. But I think, I don't know, maybe this, because I'm building my practice now, and my new and it's getting busier and busier and busier. So I think I've just got to take a breath and say, I don't have to see every new patient. I can just I'm going to do it at my pace, right?
Dr. Latina, you got to establish those boundaries.
I have to establish my boundaries.
Practice what you preach.
Yeah, there you go. So anyway, So anyway, so that's what's going on with me. But you all don't need to hear all that. But anyway, I'm going to jump back into chat. I'm going to listen closely to learn from you.
You're so sweet. Well, I hope you get to feeling better.
Okay.
I know your 2 girls are taking good care of you.
My one is here. One's up at nursing school, but Francesca's been hither, thither, and yon, picking up ice pops and saltines and doing soup. So I'm blessed. Okay, good night. I'm gonna sign off. Bye, Jot.
It's wonderful to talk to you.
Okay, bye. Bye, Jot.
All right, good. So that was Dr. Latina, and she is a psychiatrist as well. So this today was, I felt bad for Dr. Lewis. She has had a very colorful and a really stellar career. She herself in this interview says that she has been ridiculed for decades by her colleagues because her view of what dissociative identity disorder looks like is really not in line with what we actually see with dissociation. People that are experiencing true dissociative events, they are incapacitated. This is a severe mental state. It's not like, well, one day I think I'll wear pink and the next day I think I'll wear purple. No, the disruption is, like I said, in the DSM-5, critical diagnostic criteria is there has to be amnesia. And if there's amnesia, then how can you be fully functioning and hold down a job and be performing well at school? It doesn't fit, right? People that have PTSD who experience triggers and flashbacks, they will tell you those dissociative events are terrifying. They dominate. They disrupt the whole mood. Memory is shot. It's a terrible experience. And that is not what you saw with Leticia just giggling and talking about Maria Sanchez. Almost like Maria Sanchez was like a Halloween costume. It was just silly. It just wasn't, So it is sad. And like I said, Melvin Lewis is really the one that I, had read a lot on. I started out my life as a school teacher, and then I got into my clinical programs and, my master's and everything. That was all children, pediatric. And then it wasn't until, I got ready to do my internship and my postdoc and everything that I really went clinical and medical stuff. So anyway, so that's where we are. Did anybody think of any questions? Let's see. Zelda, I use the infrared pad, helps increase blood flow and motility. Sorry. Your sister is extremely irresponsible. She is cheating creditors and leaving behind. I think you guys must be having a conversation I didn't know about. Methyl B12, I know a lot about this. Cured my neuropathy. Let's see if we got any questions. One thing I guess I could talk about that I haven't yet really addressed, but maybe I should since Dr. Lewis didn't. So of course, I don't know what Connecticut law is, and I don't know what the Colorado law is. I did read up in the beginning with Leticia Stauch's trial upcoming. I don't remember now exactly what it was, but in Texas, we do have an insanity defense. It is very rare because it is very difficult to meet the standards of an insanity defense in Texas. But basically, the joke that I make is, in order to even, be able to plead not guilty by reason of insanity, you basically have to believe that you're a dragonfly and your wing is broken. And if you believe that, then you might get away with the insanity defense. It really is a situation where cognition has to be so disrupted that you just don't have the ability to understand what you did, nor do you have the ability to work with a lawyer or to work with your team to aid in your defense. You've got to be completely detached and out of it in order to really meet that standard. And that would explain why people just don't get away with it. I think we can all agree that killing a child, even your stepchild, even your own flesh and blood, I think we can all agree you're crazy. Krayzee. And that is not the same thing as an insanity defense. So, an insanity defense requires that there be a pretrial hearing. They have to file notice, I don't know, like a month before the case is supposed to go to trial. And the defendant has to give notice that they're going to try, that they're going to assert this issue of insanity. if that's just the first jump. If they can't get that on the books, then it's this issue of insanity is inadmissible and it's completely thrown out. Then you have to jump into the whole assessment and report part of the defense, and whether it's a psychiatrist or a psychologist that is going to be appointed to do these evaluations. They have to prove their excellence, their advanced degrees, that they're up to date on their continuing education. They have to be licensed in their state where they're doing the evaluation. If you are an expert in your field and you're being hired in another state to do one of these evaluations, then your licensing board in that state can give you a temporary license that is specific to go and be a part of this particular court case process, and then you do it, and then everything's fine. And according to Dr. Latina, Dr. Lewis didn't do that. She said it was too expensive. It would cost me $500 to go get me a temporary license to work on this case with Leticia. And what's so funny about it is she's making $350 a day, whether she's on the stand or not, is the way it was explained to me. That's different than the way we're paid. We're paid $600 or $650 an hour, but you don't get that per diem rate, but you'll get hotel paid for, transportation paid for. But the day of the testimony and the evaluation, that's $650 an hour. But if you're sitting around for 2-3 days waiting to take the stand, you don't get paid for those days. So it's done a little bit different. I've not ever heard this $300 every day, whether you're testifying or not. I had not heard of that. So you can, in Texas, if you have to do an evaluation for a defendant, they can't, even if they're on bail, the judge can order them to be confined during the course of the evaluation. Even if it takes 3 weeks, they will have to be jailed during that time if you want that, if you need that. So I don't know that this is I just don't see how this is going to, especially after the testimony today. She said she didn't know what the insanity defense was. She didn't know what the requirements or the legal definitions were. She did not do any sort of organized linear assessment that I saw. I don't know how she followed a rubric. I don't know how she accounted for the diagnostic criteria. I saw she admitted to failure in collecting necessary and required data points historically. I don't know how they'll never do I'm going to tell you this too. Isn't it a bit disturbing to consider this in terms of appeal? Was this an appeal issue? I don't know. Because it was so far outside anything I've seen before. I'm talking about with respect to being an expert witness, whether you're doing a fact witness or you've completed an evaluation and you're providing testimony. It just did it. There was just no substance. It was like it's like she was chatty Cathy and she was just up there chit-chatting about. It was almost like a dinner party, wasn't it? It was almost like she was at a dinner party sort of talking about her profession. It was not good. Has the diagnosis loosened up in the DSM-5? Well, I would say yeah. Well, people would say yes, specific to one issue that was loosened was amnesia. Amnesia is still a critical, it must be there, okay? However, the way in which it loosened St. Elmo is that the old DSM-3 3 required, characterized the amnesia in terms of being the result of trauma. That very similar to PTSD, that there would be like a trigger and trauma would create this episode of amnesia. Now in DSM-5, that is gone. You still have to have the amnesia, the missing blocks of time, and there's no time requirement. Like, it doesn't have to be more than an hour or more than a day or more than a year. It can be any point of missing, any block of missing time. And it can be missing normal everyday events. Doesn't make any difference whether it was trauma or just day-to-day events, right? I think it was so dismal an evaluation and testimony that she essentially clinched any chance for appeal. It's very disturbing, Dr. Latina. I worry about that. I do. It was not good. It was not good. So, all right. And the nonsense, oh my gosh, the nonsense related to her license. Well, our ethics are everything, y'all. Our ethics are the foundation upon which the profession operates. So any professional is going to defend their ethics code. They're going to follow that ethics code to a T, right? Well, not Dr. Lewis. She's just like, oh, well, I'll just have my daughter come in, and maybe my son would like to hear this interview too. And maybe he'll have some thoughts, and maybe I won't even worry about getting a license. I'm not worried about HIPAA, so why would I be worried about my licensing board? It's pretty crazy. It's pretty crazy. All right. But again, let me be really clear with this whole dissociative identity diagnosis. It is critical. Number one, it's critical there has to be some amnesia. Number two, and this is the big one for me, because this is easy to document. This is the heart of the evaluation for DID, okay? You have to go back historically, and you have to lay out a foundation of existing personalities that were discernible by others, where you have at least 2 or more identities living with this one person. And there has to be some history of this behavior that is discernible. She did none of that. None. She didn't even offer basic psychological testing. She violated HIPAA. She violated her ethics codes, the state of Connecticut and the state of Colorado laws, the licensing boards, both licensing boards. If she has a license, she may not have it very long. Maybe the good doctor suffers DID. I don't know. That was so snarky, Kate. Come sit by me. No, I'm kidding. Well, no, I'm not kidding. You can come sit by me. She said that Maria was there at age 12 and she presented other personas as names in the past. Well, yeah, okay. But let me tell you this. So my own daughter, when she was around 9, well, maybe she's a little older. Let me think. Maybe she was around 10, maybe 11. She decided that she didn't like her first name and that she really, really wanted to be known by a name that I had told her was my second choice. You know, you have these conversations with your kids, right? I really wanted to name you Mackenzie. That's what I told her. I wanted you to be named Mackenzie. And then she was like, oh, I love that name, Mackenzie. That's beautiful. That's so much better than the name I have. maybe you could just call me Mackenzie. And then she and her best friend laughed and talked and called her Mackenzie. And it was a fun thing. How many kids have you heard of that have said, "Oh, I wonder if I was adopted. Oh, that would be so weird to think about if I was adopted." That's all part of identity development. It's very healthy exploration. There's nothing wrong with that. Kids, especially girls go through this natural stage where they want a nickname. Have y'all ever noticed that? The boys do get nicknames, usually related to like their sports or some skill that they have. This is not DID, y'all. That's just part of the stages of identity development. My best friend called herself Charlie. See? Yeah, that doesn't mean DID. Yeah, that's normal. So Bill and I are adults. We're old people, right? And when we're playing, having fun or whatever, I'll call him Piddle and Bill. My kids have started calling him Piddle and Bill, being goofy. I don't think they've ever called me Jules, though. That'd be a little weird. I don't think they've called me Jules. My husband will call me Jot, J-O-T, but I don't think he called me Jules. But my husband's name is in fact Bill. Okay, so to call him Piddle and Bill is pretty, it's not a far leap. And my name is dramatically different than Jules. My name is Karen. So it was even weird that Jules ended up Jules a Thought. So Jules a Thought, the way that name came up on this channel, Jules a Thought is a group who does Middle Eastern pop music, or it's kind of like blues, right? Middle Eastern kind of blues. And so when I lived in Egypt for a very long time, and that's when I made this channel. And so it said it needed a name, and I wasn't going to put my real name. And so I just called it Jules a Thought because I happened to be listening to it it would have been the same if I had been listening to George Strait. I could have put George Strait, in the name for the channel. And so that's really where it all started. And so if you look at like when my channel was made, it was made a long time ago. Wow, Dr. Latina. Oh my goodness. Thank you. Does anybody have a coffee name? A name that they use to give the barista instead of the real name? My daughter's coffee name is Brigitte. My coffee name is Ma. It's very hip to have a coffee name. We do not have DID. That is such a good example, Dr. Latina. Thank you. Yeah. No, I'm always Karen. But I will tell you this. I had to go to the driver's license bureau, and I had an appointment and everything. And so she came up and she said, what's your name? And I told her, and she looked at me, she said, no, really, what's your name? I said, Karen. And she said, oh, I wouldn't be telling people that if I were you. Not right now. I said, I know it's a bad time to be named Karen, especially if you're on the internet. I was going to name my little boy Tesla if he was a girl. What a damn disaster that would have been. The DMV gave me DID. Exactly, Kate. Yeah, absolutely. It's terrible when you get embarrassed to say your own name. I have to make jokes about being named Karen when I'm introducing myself to, little kids or whatnot. My coffee name, Postum, made from burned beets. Zelda, you're killing me. I used to put Lutz down at restaurants. So when they called out a group, they would say, let's party. Let's party. Your table's ready. That's funny. Sketty Nona. I'm totally going to do that next time that me and Bill go out to eat. I want them to say, let's party. That's funny. All right. Y'all are so fun. Y'all are great people. We have a great channel, don't we? Very nice. Well, Dr. Latina, you are way too generous and way too sweet. And Zelda, you absolutely are way too generous and way too sweet. I appreciate you guys so, so much. And I'm going to have to change the name on this live a little bit to account for how much time we spent talking about Crazy Leticia and Dr. Lewis. And I lost, where did my, it went away. I thought it saved it when I would click. It didn't know, y'all. So, maybe I just found it. Hold on. There we go. Cheated no more. Thank you so much for the super chat. You're a sweetheart. I really appreciate your support. And there is one more. I saw it. Let's see. Sammy, you are a hero for the super sticker. Thank you, thank you, thank you. I can't even tell you guys how grateful I am for your help and support. You make sure I got everybody. I did. Okay. Thank you guys. Y'all are wonderful. I appreciate it so much. And I really do. I have such a great time coming here and talking to y'all and kind of adding a little bit of insight, you know, to what we hear about, what we learn about in some of these trials. This one is going to go down in history. This is right along with that disaster in the Jodi Arias case. Y'all remember that? I think she was a therapist and she specialized in, was it domestic violence? What was that woman's name? My goodness, I can't even remember her name. I swore I was never going to forget who she was. Y'all, I can see her. Phyllis? No, not Phyllis. Ooh. I don't remember. I told myself it'll come to me as soon as I turn this off. The master's level lady that testified for Jodi Arias for the defense, and she was a domestic violence expert, and Juan Martinez chewed her up and spit her out. It actually ended her career. It ended her career because it was so bad. I love the name Rio. He grew to be 6'6". People say to him, "Where did you get that name?" He replies, "You never seen a tall Mexican." That's so funny. I worried about my handwriting because some days I write leaning to the left. St. Elmo, you're DID. Sometimes you lean to the left, sometimes you lean to the right. And sometimes you just print. You need to name those entities, St. Elmo's. Larry Lefty and Roberta Righty and Paula the printer. There you go. You got DID. It's official. Anna Leah for 11 days. Sees Olivia. Oh. So you had twins getting Nona? Yes, LaViolette. Zelda, you're a genius. Oh my God. Alice LaViolette. How could we? Oh my gosh. How could we forget Alice? Oh, yes. That was terrible for that poor woman, wasn't it? It really was. Yep. Everything that Jodi Arias touched, she destroyed, including Alice's career. Oh, thank you, Hybrid. Thank you. Genuine plate tosser. Yeah, that was terrible. Exactly, Annette. Yeah, I get you. I had to go today and get blood drawn. They took out like 15 gallons, I think. Yeah, I'm fighting the arthritis monster. So frustrating, Annette. So over it. See, you hit my trigger. Yeah, in case you guys didn't know it, rheumatoid arthritis is, well, it's not a friend to your life. I'll put it that way. DB, good night to you and sweet dreams, DB. I'm going to be 70 in July. I can't believe it. I'm Mary Lark. Well, you know what, St. Elmo? That makes you wise. And wisdom is a valuable commodity in this world. I wish I could have been your phlebotomist. I'm great at it. Ugh. I hear it's the pits. Any chronic pain is so difficult. Chronic pain is a real problem for people. It can change the way they think. It can change their personality. It's tough. It's really tough. Yeah, that's the problem, Kate. Yep, you want to ignore it. Oh, psoriatic is tough, Sketty Nona. Yeah, it's tough. Yeah. So I'm doing the whole, what do you call it? The Mediterranean. Let me think who that is. I know you know me, and soon you will see. I was meant for you. You were meant for me. Is that the one? Hey, Bling. I died. They took much blood from me. I just had major surgery 2 weeks ago. Finally had to do my last infusion in my foot. They couldn't find a good vein in my arms. I'm so sorry, Bling. Annette had her left vein blown out. I have EDS, not the blue kid pill kind. Ehlers-Danlos. Ugh. It does, DB. I agree. Yeah. Great things on gluten-free for chronic diseases. Yeah, it's kind of the chemistry of the fast. So it's intermittent fasting. It's every other day, 25% of calories on the fasting days, but those calories are limited to things like nuts and fruit. And then I have one regular day and then one fasting day. No red meat, which doesn't bother me a bit because I don't eat red meat that much. I don't like it, but I love like tilapia, catfish, crab, shrimp, lobster. I love it. So I can eat as much of seafood, as I want, which is a great thing. No potatoes, nothing like that. And then the medicines are super hard on your stomach. They're awful. So, but I don't like to talk about it, and I don't like to even complain about it. I like to just like do what I have to do and keep focusing on the things that I like and the things I enjoy, because it minimizes it, right? When you focus too hard on it, it makes it bigger. It gives it a spotlight, and I don't want to give it a spotlight. Trying to switch over to a Mediterranean diet with probiotics for my gut health and arthritis. Yeah, what did they say? There's a medicine, sulfa something that it's supposed to take care of the bacteria part. And I was like, bacteria for RA? What? And I have a great rheumatologist. great in terms of like his published, he's a great guy. But anyway, so we're going to start the new medicine too. So, but yeah, it's got that bacterial thing like what you're talking about. I will divide it into 2 videos, St. Elmo's, because I really and truly this time we did Lori Vallow, and I really limited it to Lori Vallow. And then when we switched over and started on Leticia Stauch, I stayed with Leticia Stauch. So it is going to be really easy for me to break it apart into 2 videos. Okay, I will do that. Yeast can be a killer for RA, right, Natalie? And the other thing that I'm doing is I'm trying to get out all of the artificial sweeteners, not to include the artificial sweeteners in my diet, because they act just like the long sugars. I never wanted to know all this chemistry. You know what I mean? So the probiotics tackled that. Interesting. Listen to Natalie. Thank you, Natalie. Yeah, see, I don't know that the chemistry medical, I don't know it. I mean, I know the psychotropics, the brain, and but in terms of the gut and whatnot, I don't know about that. The sugars feed the yeast. And so that's why they say you can't have sugar, but also not the artificial sugar. Is that right? Maureen, I will listen to it. I haven't heard of that. This is a Harvard rheumatologist. No, Dr. Latina, good old UT. Yeah, Texas Longhorns. I think so, St. Elmo's. I would be willing to bet so. Yep. Well, thank you, Natalie. I appreciate that insight. That helps me understand it, because I'm feeling a little irritated about, do you even know why I'm not supposed to have my Diet Cokes? But if it causes problems with the yeast, then I need to not take it or not drink it. That'd be good, Zelda. Yeah. Okay, people, I think I'm going to call it a night. I do have a long day tomorrow. Real food sugar is a no-no. My oldest is on a gluten-free, and that helps with lupus. I really think the only thing I'm going to miss is my Diet Coke. Come in for more Vallow, but love the DID talk. Thank you, Heidi. Your Chad and Jeff's comparisons was great. I have always said Chad was a resale swap shop Jeff's. You would be right, Heidi. I am convinced that the same thing that happened with Warren Jeffs is exactly what was at the foundation of the creation of Chad Daybell as a murderer. I absolutely believe they're the same, Heidi. Yeah. I'm glad you enjoyed the video, but I'll tell you what I will do, Heidi. I'm going to take the first part of the video was about Lori Vallow and yesterday's bombshells. And then I clearly switched over to Gannon Stauch, Leticia Stauch. And so I'll edit it and cut it into 2 different videos. So I hope that helps. Still haven't bothered getting a doctor. It's coming up on 2 years. I almost got sick on Christmas Eve, but grounded my foot and Vicks and pulled through. You need a doctor, Cinnamon. Take care of yourself. Gabe, let's see. You tried the new Orbiotic Poppy Soda? No, but I'm writing it down right now. I'm going to try it because it's going to hurt my heart to give up all my Diet Coke. I'm addicted to Diet Coke, y'all. fruit flavored sodas. Drowning in Vicks. You need to go to the doctor, Cinnamon. You really do. I'm a terrible patient. I know I am. And I've been really focused and trying really hard to do right because I don't want it to get worse, So just think about it when you're trying to make yourself, ignore going to the doctor, just tell yourself, if I don't go to the doctor, I'm going to make it worse. Oh, she got sick really fast, didn't she? Yep, she was really bad. In an Epsom salt or Epsom bath. Poppy prebiotic soda, 5-gram carbs, 1525 calories a can. I'm definitely going to look into that, Dr. Latina. Thank you. Thank you. Thank you. All right. I think Kate has the right idea. So is hypermobility syndrome related to EDS? Probably. Except for this. Jay Smith. I've been looking in the history of Chad, Jeff Smith, all the way. Barry Cox in the right environment would be another. Yes, absolutely. And I do believe Lori Vallow's family of origin predisposed her. The way that Barry Cox spoke to Lori, the things that they said to Lori, they set her up for this. They created the narcissist and they included that religiosity. And so when she saw Chad, she convinced herself that Chad was the real deal. Chad knows he's a liar. Don't get me wrong. Chad knows he's full of it. He knows that. He just used religion as a stepping stone to get some, a little love, if you know what I mean. Yep. Yeah, I'm actually, that's, that whole thing with Warren Jeffs, FLDS, and Chad Daybell and Lori Vallow's progression, that's something that's really been dominating. Like I've been reading everything I could on the FLDS and how they operated here in Texas. I'm just convinced there's some kind of connection. Convinced of it, Heidi. Me too, Cinnamon. I joke with my husband that they got to be putting heroin in my Diet Coke. I'm certain of it. He's a dweeber. Yes, he is a dweeb. He's the Chadster. I'm glad that you feel better, Sketty Nona. That's why we come here, because we all got to help each other, right? Absolutely. All right, everybody. So thank y'all for coming and hanging out with me tonight. I appreciate that so much. I do hope that you'll share the video. If you want to wait until I get them, separated into 2 different topics, that'd be good. I'm going to work on it as soon as I end this live. So both of them should be finished by in the morning. The YouTube thing is so slow in editing, but I don't really feel like, downloading and then uploading it in Camtasia and then re-uploading it. It's a whole big thing. So I'm just going to do it with the YouTube app, and then it'll be done in the morning. Hey, Tessie Cooper, how are you? Welcome. It is scary, Zelda. Yep, Coburger is a trip. Uh-oh, Kate's teasing us with ice cream. All right. So I'll get it divided up. There'll be 2 videos up by in the morning, I think. I'm so glad you've been able to play, Zelda. Next number, Bach, Come Sweet Death. Record it. Make a video with you playing. I love it when you do your music. All the best to Larry and Zelda. They're the best couple on YouTube, aren't they? They're wonderful. All right. I hope you all sleep well. Tomorrow is Thursday. We're on the downslide to the weekend. Heidi said they're following Joseph Smith. Lori has similarities. If she was mailed, she would be the Chad. But I have some deeper thoughts on that. That's very interesting, Heidi. You always sound so happy. How are the birds? Thank you, Tessie. I think my birds must be asleep. They're not. I've actually got them in the other room and there are no lights on. And so I think they're sleeping. They were a little bit loud earlier, but I think they're fast asleep now. I'm so glad you feel better, Dr. Latina. You need to take care of yourself and tell your daughter I said hello. Have you ever heard concert that makes me cry? Got it halfway done. You're very talented, Zelda. Mormons make me crazy. Hi, Diane. Thank you. Y'all heard Diane H. She said, hit the thumbs up button and remember to leave a comment under the video and remember to share it to your social media because YouTube, it doesn't care about the little guy anymore. They are all about the big ones, the Megyn Kellys, Tucker Carlson. They are the ones getting their videos shared, not Jot. It's a little disheartening. I'm not going to lie. All right. But we don't need a big channel. We had a great time tonight, didn't we? All right. Y'all sleep well. I'll get the video divided up and I'll be back on Friday. All right. Thank y'all so much for coming in and keeping me company. And y'all are amazing. Don't forget it. See you later.